So we're going to talk about breathlessness and the management of breathlessness for patients. Breathlessness is quite a common symptom that people experience when they have a life-limiting illness, and it can stop you doing the things that you want to do. From a physio point of view, and certainly a multidisciplinary point of view, the management of breathlessness is really important in empowering and teaching patients how they can manage the breathlessness themselves. One of the main ways of doing that is looking at gentle breathing exercises. But before we do that, it's also important to talk about positioning and how the lungs work, because if we understand that, then that will help us. So if we imagine that our lungs are a cone shape, they're narrower at the top than they are at the bottom. And when we take a deep breath in, we naturally breathe at the bottom of our lungs, because at the bottom of our lungs we've got a diaphragm, which is a dome shape, and when we take a deep breath, the diaphragm flattens and air is drawn into the lungs, and the lungs work like a pair of billows. When we become breathless, and that can be for lots of different reasons, our breathing will change, and instead of breathing down and nicely at the bottom of our lungs, we start breathing much more at the top of our lungs, and the lungs open up, but you're not getting as much air and oxygen throughout the lungs at the bottom. So the breathing pattern changes, get tight in our shoulders, and we get less air and oxygen on board. We become more breathless. We've got this horrible vicious circle of breathlessness, and with that the feelings of anxiety and worry about your breathing, and the whole thing is exacerbated. So when we look at breathlessness management, we're looking at the person getting back in control of that breathing pattern again, so that they're breathing much deeper at the bottom of their lungs, using their diaphragm more, and getting their breathing back in control. Because your diaphragm sits underneath your lungs, you need to be in a really good position to allow those lungs to move and that diaphragm to flatten. So being upright in a chair is a really good position, nice and relaxed, so you're not overly using your shoulders. Some people like to rest their arms on a pillow. Other positions are leaning forwards in standing, and also leaning forwards in sitting. So you rest your elbows on your knees. That can help because tummy falls out of the way and diaphragm can move really nicely. The other thing that's really helpful too is we've got a handheld fan. And the cooling effect that a fan has really helps people with breathlessness. It cools a nerve at the back of your nose that sends a message to your brain to just calm your breathing back down. So something as very simple as a fan can make all the difference as well. So if we go through some breathing exercises and have a look at that. So Bernard, thank you very much for working with us.
My pleasure.
Thank you, and showing us. We're just going to go through some breathing exercises for you, or with you. We talked earlier about how the lungs work and getting yourself in a really good position, and there's also a fan here that you can use when you're doing the breathing exercises. I think if we pop that aside for 1 minute, and we can maybe use that a bit later. Lovely. So you're in a really good position in the chair, your shoulders are nicely relaxed and nice and supported. And we talked about breathing from the bottom of your lungs. What you can do to start with, Bernard, is you can feel how your breathing's doing by putting one hand on your top of your chest and one on your tummy. And you can just breathe normally and see which hand is moving the most. Well done. And your lower hand's moving nicely, which is good. Lovely. Brilliant. And relax your hands, that's smashing. Just relax your hands down. So the breathing exercise is called breathing control, and it's about putting you in control of your breathing rather than your breathing being in control of you, as I think it has been at times.
It has indeed.
So it's about taking nice gentle breaths at the bottom of your lungs. It's not big breaths, it's just nice gentle calm breaths. And generally we'd say in through your nose and blow out through your lips nice and gently. Lips gently and slowly. Lovely. You're doing brilliantly, not moving shoulders or head, it's just breathing really nicely. Often it doesn't look like it's a deep breath, but it is because it's all moving the tummy area. That's lovely. Well done. Some people like to blow out through pursed lips, so you can blow out gently through. Lovely. And it's just nice, gentle breaths. And when you've mastered this in sitting and got used to it in sitting, Bernard, over the course of a few days you can try it if you're a bit breathless when you get to the top of the stairs, and incorporate it in episodes when you are breathless. It's a really good technique to practice for 5 minutes a few times a day, and just slow, gentle breaths. That's lovely. That's brilliant, Bernard. Thank you very much. Thank you.